Welcome to the e-learning module on pathology of ovarian tumors. In this lecture, I'll be covering few of the epithelial ovarian tumors. The learning objective of this lecture is to enlist various epithelial tumors of the ovary, describe the features of endometrioid, clear cell and brenner tumors, and to differentiate benign, borderline and malignant tumors in these categories. The contents are covered as classification of various epithelial tumor, pathology of endometrioid, clear cell and brenner tumor, and at the end summary. As we have already discussed, the epithelial tumors WHO has classified as serous, mucinous, seromucinous, endometrioid, clear cell, brenner cell and other uncommon carcinomas. Coming to endometrioid tumors. So endometrioid tumors, based on the proliferation, there is benign tumor, borderline tumor and malignant tumor. So benign and borderline tumor among endometrioid tumors are quite rare. Benign tumors can be cystadenoma or adenofibroma based on cyst and fibrous component. Borderline tumors are called as endometrioid borderline tumors. Malignant tumors are called as endometrioid carcinoma. So 15 to 30% of ovarian endometrioid carcinomas are associated with carcinoma of the endometrium. So in some instances, endometriosis can be considered as precursor to endometrial carcinoma. So carcinoma accounts for approximately 10 to 15% of all ovarian cancer. So this is the most common ovarian carcinoma after serous carcinoma, whereas benign and borderline tumors are uncommon. Coming to the pathogenesis, there is association of endometrioid tumors with endometriosis of the ovary. So this tumor comes under type 1 tumors, which is having some precursor lesion. So endometriosis can lead to either endometrioid type of tumor or clear cell type of tumors. So coming to benign endometrioid cystadenoma or adenofibroma, these are mainly cystic lesion which are lacking endometrial stroma, but they have endometrial-like epithelium. So to discriminate the tumors from the endometriosis, there should be lack of endometrial stroma. If there is presence of endometrial stroma, means it will fit for endometriosis. So the grossly it can be a cystic lesion with the hemorrhagic areas, as there will be bleeding from the endometrial type of gland. It is a hemorrhagic lesion. On histology, we can see the tubular or cystic glands which are lined by cells which resemble endometrial type of epithelium, and the stroma will be fibrous stroma but not endometrial type of stroma. Coming to endometrioid borderline tumor, these tumors are composed of crowded or endometrioid type of glands which are lined by atypical endometrial type of cells. But there is no destructive stromal invasion or confluent glandular growth, which will differentiate these tumor from endometrial carcinoma. So usually it is seen in around 50 years age group and it has got good prognosis. So this is the histopathology of endometrioid borderline tumor, where the adenofibromatous pattern characterized by back-to-back pattern of glandular arrangement having some amount of nuclear atypia. This is intracystic glandular or papillary pattern where there are only glands with very less stroma. So these are the papillary-like growth. Coming to endometrioid carcinoma. So these are malignant epithelial tumor which will resemble endometrioid carcinoma of the uterine corpus, body of the uterus. So 85 to 90% of these tumors are associated with endometriosis. So the molecular genetics involves mutation in PTEN, which is also seen in endometrioid carcinoma of the uterus. Grossly, it can be cystic or predominantly solid tumor with areas of hemorrhage or necrosis. It can reach up to 10 to 20 centimeter. On histopathology, we can see confluent glandular pattern with no intervening stroma. So here there is back-to-back arrangement of atypical glands. So prognosis is usually good, and staging is the main important prognostic factor. So squamous differentiation, usually it is known to have squamous differentiation. So if there is squamous differentiation, the prognosis is favorable. Coming to clear cell tumors. So clear cell tumors, again based on the proliferation, there are benign, borderline and malignant tumors. So clear cell cystadenoma or adenofibroma is a benign epithelial tumor which is composed of small round glands lined by bland clear cells with variable amount of fibrostoma. So the main criteria here is the cells which are having abundant clear cytoplasm. So these clear cell tumor also similar to endometriotic tumors, they known to have association with endometriosis. So this is a benign clear cell cystadenoma where the fibrous stroma is seen, and in between the stroma there are round glands lined by clear cells. The clear cell borderline tumors are tumors with glandular crowding and they show low grade nuclear atypia, or but there is no stromal invasion. So clinically it is a unilateral tumor and microscopically we see glandular crowding and cellular stratification. This is a borderline tumor where there is stratification of the cell. That means the cells are overcrowded and the cells are having clear cell cytoplasm. So they are called as clear cell tumors. The clear cell carcinoma, it is an invasive tumor having abundant clear cytoplasm, and the typical feature here is presence of hobnail cells. So they have tubulocystic or papillary or solid pattern, and 50 to 70% of these tumors are known to have association with endometriosis. Average age of presentation is around 50 to 55 years age group, and these set of tumors are known to have paraneoplastic syndrome like hypercalcemia or venous thromboembolism. This is a gross picture of clear cell carcinoma. So it can arise from a background of endometriosis, though, so there will be lot of hemorrhagic areas, cystic areas, or it can be predominantly solid, but there will be areas of hemorrhage and necrosis. This is the microscopy of clear cell carcinoma where there is tubules or solid pattern. This is the tubular pattern. This is the solid pattern. And the peculiar feature here is presence of hobnail cells which will have the nucleus which is more towards the lumen, not towards the basement membrane. So this is the solid pattern which is having cells with abundant clear cytoplasm. So this picture shows the glands which are showing typically apically placed nucleus. So that is called as hobnailing. So here the nucleus will be apically pushed, bulging nucleus. That is called as hobnailing, which is a characteristic feature of clear cell carcinoma. So genetic profile, the 46 to 57% of these cases can show ARID1A mutation, but there is no association with BRCA mutation. So the most helpful marker in diagnosis of clear cell carcinoma are HNF1 beta and napsin A. So in differentiating from other tumors, these markers will help in diagnosis. So coming to next group of tumors, Brenner tumors. So Brenner tumors have the epithelial nest resembling urothelium or epithelium of urothelial tract. So similar to other epithelial tumors, we have benign tumor, borderline tumor and malignant tumor. So benign and borderline tumors are uncommon. So it can be a cystic or a solid tumor. So in a background of solid area, we can see cystic spaces. So that background of solid area is mainly the fibrous stroma. So there will be fibrous stroma, and in between the stroma, there will be epithelial nests. So these epithelial nests will resemble urinary tract epithelium. So these are this is the histopathology picture where there is fibrostroma. So all these are fibrostroma, and in the stroma there are embedded nests of cells which resemble urothelium. This is the picture of malignant Brenner tumor. So there will be all features of pleomorphism, anaplasia, hyperchromatic nucleus, and the arrangement is like urothelium. So to summarize the epithelial tumors, so epithelial tumors, there are various types. So they are classified based on the proliferation as benign, borderline and malignant. About 80% of ovarian epithelial tumors are benign and malignant tumors occurs rarely and it most commonly seen in older women. The major three histologic types of epithelial tumors are serous, mucinous and endometrioid tumor and all of which have benign, borderline and malignant category. Benign tumors have well-differentiated epithelial cells with minimal proliferation, whereas borderline tumors have increased cell proliferation and complexity of the glands, and it covers more than 10% of the tumor cell areas, but it lacks stromal invasion. Malignant tumors have severe epithelial atypia and they show frank stromal invasion. Majority of the malignant epithelial tumors are high-grade serous carcinoma and BRCA associated tumors as well as majority of the sporadic ovarian tumors are serous tumor and they likely arise from fallopian tube epithelium rather than ovarian epithelium. Clear cell tumors and endometrioid tumors are associated with endometriosis. The characteristic feature of clear cell carcinoma is hobnail cells and Brenner tumor resembles urothelium epithelium. These are the references. Thank you.